This stream is brought to you by Innovative Financial. Hello, my name is Jordache, and I am the Chair, CEO, Owner, everything of Innovative Potential. Today I'm going to be talking about, I'm going to be reading from, this is going to be a reading from the Health Value Economics and an explanation of what's going on with the Health Economics document. It's basically there to describe and act as a resource for how to put together something like Innovative Potential, and to act as a starting point for other financial or other economic type of documents. And I'm gonna jump over quick right now and get started. I'm gonna be down here in the corner this whole time, and we're gonna start with some cancer statistics. Moving on in through Innovative Financial, the Health Value Economics, and then doing a summary sheet. So these are the working cancer statistics that we use at Innovative Potential. They're there to they're there as a running clock guide, basically. So they're just a summary sheet from some other summary sheets, but these are the ones that we're using because you have to use something. So these are our working cancer statistics. And the cancer statistics that Innovative Potential Incorporated and Innovative Potential Limited Liability use are derived from the Statistics Canada annualized and generalized cancer mortality rates, and from the United States, the Centers for Disease Control's equivalent statistics. These two national numbers are non-differentiated cancer statistics. They do not discriminate between lung, colon, breast, etc. types of cancer. The U.S. data are current as of 2022 and are taken from the American Cancer Society publication, Cancer Facts and Figures 2022, Atlanta, American Cancer Society, 2022. And the Canadian data is current as of 2022 and is taken directly from Statistics Canada webpage, indexing the term cancer mortality and then mathematically constructed. These values incorporate COVID-19 surgical backlogs and complications. So basically those numbers there are 608,570 deaths per year due to cancer in the United States and 84,600 deaths per year due to cancer in Canada. During the 20-year life of Innovative Potential's patents, it is estimated that 39 million people will be diagnosed with cancer in America and 4.6 million people will be diagnosed with cancer in Canada. These two numbers are then divided by 365 days to obtain an average number of deaths per day due to cancer in each of the nations, which is 1,667 and 222 respectively for the United States and Canada. The 5-year general all-cause cancer survival rate is approximately 65% plus or minus 3 to 5% for both nations, and 35% of all people will die after their first diagnosis within 5 years. It is estimated that the number of deaths due to cancer without electroactivated chemotherapy intervention across the 20-year lifetime of the Innovative Potential Incorporated patents is respectively 12,171,400 and 1,624,000 in the United States and Canada, totaling 13,759,400 people. So that's roughly 700,000 people per year die, and we're gonna take those numbers and try to give them a financial meaning, just in terms of we have other talks on this subject material, this electroactivated chemotherapy, on the YouTube page. So do this, file, subscribe, and like. And now we're speaking in terms of finances and economics. So how much resources, how much money is required to be able to implement and deploy this, and how many people will it affect, etc., etc. And this is sort of like the starting ballpark. So if you want some of the scientific information, there's a whole hour talk on that. On the electroactivated chemotherapy itself, there's a whole talk on cancer biology itself. There's a whole talk on health literacy. There is a whole talk on asset creation. So Innovative Potential is walking you through all of the steps, hand-holding and spoon-feeding and step-by-stepping it. What's happening here is we're now speaking on the financial issues with health value economics. So this document, available on the Innovative Potential website under the second pages of publications, is a summary of the economic considerations fueling Innovative Potential Incorporated and the chemotherapeutic potentiostat. Health value economics outlines a large economic picture in terms of gross domestic product and includes considerations incorporating cyclophosphamide industrial size to give an approximate valuation for this marketplace. This document is very similar to the financial section of the business plan by Innovative Potential Incorporated, differing only to expand upon larger scale economics. Summarily, the economic conditions of a nationally profitable EAC intratumor injection surgery are described on a per capita basis, including a patent valuation and a route to market. A nation must have a GDP greater than or equal to the cost of the surgery to break even in terms of GDP per capita expenditures, or to be considered profitable. If using the industrially standard value of quality adjusted life year, profitability occurs at a GDP per capita of $50,000. The procedure is profitable in the US in all scenarios, even if the patient dies. Canada is never profitable in any scenario and requires an increase in GDP per capita of $7,000 US to break even. A global and a Canadian-US combined scenario are investigated also. A global market is never profitable with a GDP per capita of $10,000. The Canada plus US simulation, similar to Innovative Potential's ownership situation, demonstrates a break-even condition with a GDP per capita of $53,000. The EAC procedure is profitable at diagnosis, but will only break even in terms of profitability when used at later stages of the disease. The at-cost price of a Joey system in 2022 is $539.19 Canadian, taxes included, and $623.94 US dollars untaxed. This does not include the price of a power supply, vial adapters, tubing, drugs, lure lock connectors, needle syringes, or labor. So how this document is broken down is, just finished the title page, the abstract, read the table of contents. The next thing is the introduction, the business, which is Innovative Potential, the nature of the industry size, a segment on the value of life, competition in monopolized markets, patent market valuation, minimally viable product, cost analysis, shipping, and at-cost values. So we're taking a funnel shape on this approach, that we're going from the very wide and very we're starting at the world and we're dropping it down to the surgical suite, and going over cost, benefit, cost analyses at each one of those tiers downward, from here's the planet to here's the guy who's going to use the machine. So for the introduction, and I like to make note that again, this document is supplemented with a whole bunch of stuff on the website and other YouTube video talks So just please keep that in mind. If I say EAC, I'm referencing electroactivated chemotherapy. You're in the rabbit hole now. So canonically, the economic argument for electroactivated chemotherapy. Just want to make sure this is good on the zoom in a little bit. Is this good? Okay, everyone can follow along. Canonically, the economic argument for electroactivated chemotherapy, or EAC, the chemotherapeutic potentiostat, and innovative potential incorporated was made when it was realized that an artificial mechanism for bioactivation was possible. The realization of the economic argument is derived from the possibilities of acetaminophen and cyclophosphamide being exemplar drugs for EAC, two molecules which already have independent multi-billion-dollar globe-spanning military-industrial complexes devoted to their make, manufacture, use, and promotion. Both acetaminophen and cyclophosphamide are accepted the world over as mainstay societal pharmaceuticals and are both listed on the World Health Organization's list of essential national medicines. Both acetaminophen and cyclophosphamide are drugs which are approved for intravenous diffusion in Canada and the United States, the world over also. And both acetaminophen and cyclophosphamide are bioactivated to elicit their pharmacological effects. The large-scale societal use of acetaminophen and cyclophosphamide in the context of EAC, in combination with the low prices of electricity and graphite, gave rise to a viable business as Innovative Potential Incorporated. For more information on these molecules and EAC can be found in the electrochemical generation of reactive species and their application as chemotherapeutics, Boudreau 2012. So that's the thesis. If I'm ad-libbing here and referencing the thesis, there are three main documents. There's the thesis, the patents, and then some of the presentations or the peer-reviewed journals. So there's a whole other non-company set of references, and this is what's happening. This is what I'm referencing. So the business. Circa 2022, 1,886 people died per day within Innovative Potential's patented nations. The conservative, which is Canada and the United States. The conservative approximation per day is at 222 people plus or minus 15 in Canada and 1,664 plus or minus 200 in the United States die from all-form cancer. All-form cancer is an aggregate term for the disease, undifferentiated from tissue ideology. For example, there is no distinction made between lung, colon, and breast cancers. It's all cancer. No distinction is made at Innovative Potential Incorporated for two reasons. The first being during fatal late-stage disease, there are often many different cancers subpopulating the same tumor, and many tumors occupying different tissues independent of starting tissue type, often with independent drug resistances. And, secondly, the EAC technique has not been subjected to the information proliferation that independent molecules are when attempting to determine their conditions of best use. Like the general curative mechanisms of radiation and surgery, there will be multiple cancers where EAC can be applied as a first and last line treatment option based on tissue ideology and disease progression. The company's proprietary technology acts as an artificial liver enzyme, activating non-toxic molecules into potent drugs. Innovative Potential Incorporated owns the only tools capable of activating these drugs outside of the patient's body. From 2009 to 2012, a series of proof-of-concept experiments were conducted to validate the technology and drug activation concept in vitro using two different classes of clinically approved drugs, acetaminophen and cyclophosphamide. Shown in Figure 1 below are some of the in vitro experimental results measuring cancer cell survivability and the effects of the treatment by the chemotherapeutic potentiostat apparatus, 2012. Innovative Potential's technology is capable of improving the lethality of both acetaminophen and cyclophosphamide by 95%. This is considered to be within the limit of detection of the assay used, as compared to without its use. The point is, the improvement is not non-zero, and is an over 95% improvement on a dose-per-dose basis for two drugs with clearance to flow freely through a cancer patient's circulatory system. This is figure 1 from page 82, section 5.5 of Boudreau 2012. Figure 1. EMT6 cancer cell viability before and after treatment with electrolyzed solutions of acetaminophen and cyclophosphamide in the chemotherapeutic potentiostat batch configuration. Initial concentrations of 5 millimole per liter were used as at a graphite anode with a current of 5 milliamps. Percent viability, ability to live successfully, corrected relative to untreated cells. Control was 50 microliters of milky water at a p-value, student t-test p-value significance of 0.005. Figure and caption created from data taken from section 5.5 Boudreau 2012. As a standalone image, what that means is basically, this as a standalone image needed a little bit more wording in the figure caption to be able to make this make more sense without the other 10 images around it. So basically what's happening here is showing that the electrolysis of the drug is responsible for making the solution cytotoxic, and that's what's happening here in the left and the right hand side of where the black and gray bars disappeared. That's what happened. We turned the machine on. If we don't turn the machine on, nothing happens to the drugs, and the cells and the cancer cells live. So it's not a very difficult situation to superimpose and begin to set up a clinical trial for, where if we do nothing with the cancer cells themselves, in the sense that if we don't use the machine, they just do what they want. If we do use the machine and we turn it on, then the cancer cells die. So that sets up a situation where a doctor or a surgeon now has power and control of putting where he wants the cell death to occur manually, not by radiation, but through a chemical ablation surgery. That's what this is. This is the machine that makes a chemical ablation surgery possible. So the nature of the industry. The medical device industry is dominated and driven by consumption and disposal of non-technological medical supplies which support the function of non-disposable technological devices. For example, disposable IV tubing for a non-disposable IV pump. Medical device companies are technologically driven and are composed of science, technology, engineering, and medicine experts. They all know math, but it's medicine for the M. The M in STEM is medicine, not mathematics. The creation and production of medical devices are globally highly valued long-term investments to satisfy essential healthcare needs, either for specific procedures or diseases. For example, blood glucose monitor and test strips. Or in more general functions, surgical scalpels and disposable blades. The disposable medical supply industry itself is a multi-trillion-dollar industry with production factories existing in Germany, the United States, China, and Southeast Asia. The industry size. This is where we start adding numbers in here, because it's just sort of, before it's sort of like, this is the introduction. This is, so we've covered why we exist, where this thing comes from, what topic we're actually functioning on, and then now we're going to talk more about, well, what is, so we've sort of laid the, here's the land, we've laid the perimeter around it, the fence around it. Now we're going to talk about the surface area in what we fenced off. Industry size. There are roughly 6,900 hospitals operating in North America, 5,500 American, and 1,400 Canadian. From 2012 to 2017, the National Cancer Institute annually spent an average of $3.2 billion researching cancer biology and cancer treatment options. It's from the National Cancer Institute 2018. In 2015, the U.S. spent a total of $20 billion on cytotoxic and non-radiated targeted oncological therapies. So $6.3 billion on cell killing things, drugs, chemotherapies, treatments, and 13.9 billion on non-radiated targeted oncology, so surgeries. So basically, if we spent 14 billion-ish on surgeries. And that's from the IMS Institute of Health Informatics 2016. Approximately 1,000 people die per hour due to cancer globally. Within Innovative Potential Incorporated's patented jurisdictions of the United States and Canada, approximately 1,886 plus or minus 250 people die per day. Approximately 220 in Canada per day, and approximately 1,600 in the United States per day. Because Innovative Potential Incorporated operates in terms of patented oligopolies, it is better to think in terms of industries, not companies. An industry is a company of companies specialized in the production of a specific product, product family, or affiliated for a common goal or purpose. For example, the aerospace industry is a collection of manufacturing and scientific companies for the exploration of space, but will also contain significant human health expertise for surviving the journey. Two industries helping to define Innovative Potential's technological niche include intravenous pumps and the drug cyclophosphamide. In 2016, the intravenous infusion pump market in the United States was worth $8 billion and is expected to grow to $10 billion by 2020. The North American market size for injectable cyclophosphamide formulations has a North American market size estimate of $410 million. One estimate of Innovative Potential's global surgical market identified is approximately $100 billion. This includes human and veterinary surgical market niches. The chemotherapeutic potentiostat and EAC are compatible with multiple drug classes. To date, Innovative Potential prefers 5 globally distributed in-use pharmaceuticals compatible with its technology for round 1 in vivo clinical assessments, including acetaminophen, a painkiller, bleomycin, an anti-cancer, cyclophosphamide, another anti-cancer, ifosfamide, and trophosphamide, two anti-cancer analog molecules of cyclophosphamide. Opportunity exists to develop chemicals exclusively for use as treatment options with EAC's mechanism of drug activation, expanding the $20 billion market for cytotoxic and non-radiative targeted oncological therapies. So what I said there just basically means that the patented medical device can work on multiple drugs. And what's better, it can work on multiple drug classes. So acetaminophen is one drug in one class, and cyclophosphamide is another drug in a different class. What we're saying here is just that this machine works on apples and oranges together. It's a fruit punch. It's a fruit punch blender maker. Put them all in, watch them go. The value of life. Okay, this one, okay. Do I want to move on from here? Life is already valued at Innovative Potential Incorporated. Maintaining life is one of the reasons for the company's existence, as well as the EAC technology. To monetarily value the EAC procedure is to put a value on the lives of cancer patients in their time of most need. This was already done in the creation of the technology itself, but not financially or economically defined. However, a technology is deemed cost-effective and nationally adoptable if the procedure is less than $50,000 per quality-adjusted life year. An industrial standard value that incorporates the cost of performing a surgical or medical procedure. A quality-adjusted life year is a year of quality life if a procedure is performed. In Table 1 below, the minimum value for a profitable EAC procedure is described in terms of GDP per capita in US dollars. Before I get to Table 1, I want to go back to this quality adjusted life year. It's basically if the doctor, for the doctor to do a surgery, it will cost $50,000, but the doctor may or may not do the surgery if it's not going to give you that extra year of life or get you close to that year of life. It has to be worthwhile for everyone to do the job, kind of thing. Even if if a patient is in not good enough health, a surgery won't be performed because they won't get a benefit out of it. That's kind of what is embedded in that value number, is a difficult decision-making process that is unique to every patient and medical case. So on to Table 1. So what we see in Table 1 is the minimum GDP per capita for EAC in US dollars in 2022. The highlighted section over here on the right-hand side is an equilibrium simulation created from the average of values obtained from Canada and the United States. It's meant to approximate what innovative potential is actually patented. Recalculated values, so over here, the second row, second column, the bottom right-hand corner is called recalculated. Recalculated values are not average values of Canada and United States columns, but instead derived from the Canada and USA values. Steady state is obtained from the deaths per day subtracted from the diagnosis per day, and is a measure of the people alive with cancer. So now I'm going to get into what we're doing here. So in the top left-hand corner, we have cancer diagnoses per day, cancer deaths per day, steady state cancer per day, GDP, and the cost of surgery. So what I was speaking of on the steady state is if you take the cancer diagnoses per day and subtract out the number of people who died, you end up with a steady state. So these are the people alive with cancer today. And then I have this separated for Canada, the United States, globally, and then just Canada and the United States. Globally, including Canada and the United States. So that right there sets the stage of how money is going to be factored into the people being diagnosed, the people being alive, and the people who have died. So in association with the cost of this proposed intratumor injection, drug activation surgery. So basically what was done next on a per day basis was we took the number of cancer diagnoses per country and multiplied that by the GDP of the country. So that's sort of saying, even though these people have a cancer diagnosis, they still actively contribute to the economy of the country. There is a way to say, like, no, these people are, like, don't write them off. They're still, like, basically saying, just because you have a cancer diagnosis doesn't mean you get written off. You still have to eat. You still you still shower every day. You still eat. You still have to turn electricity and heat on. So all of that is still like an economic number for the people with a cancer diagnosis. And then we go again and say, okay, well, here are the people. It's sort of like, well, there's your day one diagnosis people, but what does it look like in steady state? So here's the next. So if we take out the number of people who died that day, here are the people who are sort of like diagnosed and alive. And then again, even with the cancer that, like, even if you died that day of cancer, there's still a burial and there's still a funeral and there's still that part of participation. But basically what we're showing here is cancer diagnoses, and like having someone die is a terrible thing, both spiritually, like person, like it's a personal loss, but at the same time it's a big economic loss. People with cancer, like surviving with cancer is more valuable. Like if you need to make an accountant-based decision, people being alive is worth more than people being dead. And that works across the board. And that's what we're kind of showing here. And then we're saying, okay, if we take those numbers, those GDP-based numbers, and then apply the surgery to them. So basically what we're saying here is like, okay, well, we have to make this be, we take the cancer diagnosis GDP, so we take the number of people with a cancer diagnosis, multiply it by a GDP, then take that same population and multiply it by the cost of the surgery. So everybody who's alive makes this much money in GDP, but then everybody who needs the surgery is also worth this much. So the idea here is that A is going to be greater than B, and then the entire country is able to do this and still make money off of it. So unfortunately, the table showed that Canada's GDP isn't high enough, but the United States is. The world is not the world. If you just do all 8 billion people, all 8 billion people don't have enough GDP to be able to do this. Canada and the United States together, they do, but they only have enough money to do the surgery at the diagnosis, and then they break even at a steady state in a cancer death. So what does all that mean? So all of that basically means is if your individual nation can reduce the cost of the surgery through the use of its own resources. So I'm just using cash as it's straight up cash. The world doesn't operate in straight up cash. There's charities, there are state products, like there's a lot that goes into reducing the cost of something that has to be done so frequently. So a state corporation that manufactures that refines its own gasoline or plastic products can take the cost of the surgery down quite significantly. A huge government subsidy going towards lowering the cost of this surgery is another way that this, so it's like if you can change that $50,000 to be $30,000 or to be $5,000, then everybody wins. It's just sort of the insurance industry kind of sets any kind of blanket surgery number at 50,000. So we're using that. It's a starting point. So ultimately, the nation must have a GDP per capita greater than or equal to the cost of the surgery. Therefore, a GDP per capita greater than or equal to $50,000 will provide for a profitable economy of scale for the adopting nation. If the GDP is less than the cost of surgery, the nation will lose money performing the surgery on a per-person basis. From Table 1, Canada, as a country and nation, does not qualify for profitable EAC intratumor injection surgery, demonstrating a $266 billion economic shortfall in US dollars. In order to qualify for adopting a profitable surgery into its currently existing healthcare system, Canada needs to increase their GDP per capita by approximately $7,000 US or demonstrate that the cost of surgery can be significantly reduced. So this is basically saying that Canada needs to get a third of its GDP up. It needs to get an additional third of its GDP to be able to have this be profitable. Or demonstrate that the cost of surgery isn't $50,000. It could be well below that. From Table 1, the US is always able to be profitable from performing EAC intratumor injection surgeries. The US will profit $20 million per day just by performing the EAC surgeries on people who will then die later that day. And the global GDP per capita is $10,925 which is insufficient to afford EAC. The simulation approximating the profitability equilibrium for EAC demonstrates an economic advantage of performing the surgery earlier in a cancer case, with a $9 million per person profit if the surgery is performed at diagnosis. If surgeries are delayed, the treatment becomes a break-even cost scenario, but never unprofitable. So basically that has a little bit of a real, okay, let me finish this, excuse me. Note bene. It needs to be made explicit that so far only the market potential of just the human intratumor injection surgery market is being considered. Acetaminophen and cyclophosphamide are both approved for veterinary uses, and the chemotherapeutic potentiostat equipment itself has markets in molecular development and design. And there is potential of treating other diseases with other drugs, like vaccine usage with the equipment. So this is sort of the fruit punch analogy. So two things. The note bene is making reference to the fruit punch analogy, where it's like, I'm only demonstrating that a fruit punch can be made with this blender device with apples and oranges. But there's kiwis, there's grapes, there's cherries, you know what I mean? There's watermelon. Like, just basically this machine and this device is capable of using all of the fruits for a fruit punch. You know, like that's it's not just one molecule. It's all molecules. And since it's hardware, it can go towards, you know, like those vaccine guns from the 50s that they used for smallpox and polio or whatever. The same idea goes for, you can run a COVID vaccine through this hardware. That's sort of the idea here. Some of the portable models of it. But then there's another part I wanted to mention up here. Okay, this equilibrium. What are you talking about with this equilibrium? In the recalculate on the bottom right hand side of the graph here, this $9 million, it's basically saying Canada and the US, if they do the EAC surgery at cancer diagnosis or earlier stage, then they'll be able to profit like $9 million for all of the diagnoses. You're gonna save, it's like you're going to save $9 million from your GDP by doing this surgery early in your cancer life cycle. If you wait from it's a zero cost. It's a zero cost if the patient dies and you still do it. And if you let the disease progress, it's still a zero cost. But you're really getting most of your costs if you do this thing up front. And this is the economic case for and it works for you're not out of line of prevention, but rather than try and fool around with a intravenous solution, go in there and do the intratumor injection on it first while the patient is still healthy, so that third, fourth, and fifth lines of cancer treatment can then be investigated. Before you take them off, before you affect every system in the body, just do the surgery. See if you can get control that way with a little bit of intravenous, and then work your way back into the regular sort of what we're doing now clinically. That's what that cost savings is saying. Okay, competition. Disclosure. Ultimately, it is the attending physician or primary healthcare provider who will decide the best treatment options, when and how to use them, and on behalf of their patients' unique healthcare needs. I gotta say this twice. Ultimately, it is the attending physician or primary healthcare provider who will decide the best treatment options, when and how to use them, and on behalf of their patients' unique healthcare needs. Innovative Potential has created a secured market through the creation of a 20-year US and Canadian oligopoly by using patent infrastructure to exclude anyone from making, using, offering for sale, selling, or importing products, and to exclude anyone from making, using, offering for sale, selling, or importing products made by the process. This includes performing medical procedures. Additionally, there exists a collection of published peer-reviewed articles describing the central ideas of the biomedicine and technology acting as disincentives from others creating patents. Third parties intending to act as competition are excluded by 2 scientific disclosures and 2 patents, and the company's own publications. Previous disclosures dissuade new patents from being able to be granted. It is Innovative Potential's intent to license further industrial development rights to manufacturing companies and to avoid direct responsibility for manufacturing at large volumes. Now, what this basically means is because some of the startup costs are very expensive, so we're talking $20,000 to $50,000 for a 5-cell, so we're going to take 5 different types of cancer cells and use the Joey on them, and that's going to cost approximately $50,000. It's going to cost close to $1.5 to $2 million to be able to then take those cancer cells, put them in mice, and guarantee that the mice are basically given an extended survival time through the use of the Joey versus without the use of the Joey. And again, there's also the organization and clinical trial, which begins to approximate $1 to $3 to $5 million. So basically, in order to keep costs down, we have legally created a situation in which nobody north of Mexico, including Hawaii and Alaska, Puerto Rico, Guam, and some of the Samoan Islands, and other U.S. territories, are going to waste their money doing something twice. They can then do, I guess they would be confirmational experiments. But basically, because the costs of doing this are so expensive, we're saying we're the one-stop shop. We have legally said we are the one-stop shop for this. Any investment or research dollars come to us. We do it because if this thing was to fail in any way, shape, or form, unbeknownst to the drug manufacturers, unbeknownst to the clinicians, unbeknownst to the surgeons, unbeknownst to the drug developers and drug creators, we're gonna, like, no one's gonna be wasting their money on it, basically. So that's what that's saying. Intravenous cancer treatment options such as conventional chemotherapy, gene therapy, and immunotherapy are not considered as competition to innovative potential. These treatment options are non-surgical in nature and should be regarded as supportive or complementary techniques to innovative potential's technology in assisting patients undergoing cancer treatment. The nature of the disease dictates when and where a tool can be used and how. So we don't have any competition. If we do, we sue them and say, don't. It's if you really want to work on this badly, work with us, because we're about 20 years ahead. We're 15 years ahead now, and we're going to be an additional 20 years ahead again. So work with us rather than try to short circuit some stuff. You can take our principles. The principles are just basic science principles, so go, knock yourself out. But at the same time, this is a piece of hardware, and this hardware is the only piece of hardware. The end. So, that's a good brief break for our sponsor, Innovative Financial. If you don't know what we're talking about, pay us, and we'll inform you. Innovative Financial. So the minimum patent market valuation. So what does that mean? It's basically so if you have an idea, what is that idea worth? So it's like you get an idea to make a new type of pen or something like that, and you want to say, okay, well, what's okay, well, how much? You know what I mean? Like the minimum patent market valuation is just that. It's how, if everybody hates your idea because they hate it, right? But they still can't disagree with you. So it's like, if all the truth is just put into one, like, concentrated, like, object, if all of the truth is like, you can't disagree with the truth, but I don't like you, so I'm not going to do it with you. I'm going to say no to everything else, but I won't disagree with the truth. That's kind of what this is. So it's like, if we take all of these assumptions and compress them into a tight little ball, that little ball is the minimum patent market valuation, without lying and without being super exaggerated or anything like that. It's like, oh, the hype machine, there is no hype machine. This is like an anti-hype machine. This is a smoldering sort of like core of boring and truth. That's what the minimum patent market valuation. So a patent in the hair industry, so a patent for a blow dryer might be used by more people, but that might not be as valuable as a patent in a hardware industry. So this is the logic that goes into say, okay, if all of the people who need this are this, so here are all the people within the territory that we claim. Of all the people that are in the territory, this many people need this, or are going to use this. And then if there are any additional associated costs, because what happens here, and it goes back to the competition thing, when the patents expire, the world goes back into a perfect competition. And what a perfect competition is, it's something like if Applebee's is in a perfect competition. Food restaurants are in a perfect competition market environment. They might not have, we assume that food doesn't have any patents on it. There could be like machinery productions and stuff like that, but basically all you need is a pot of soil to grow some food. So there is no protection for that unless the government makes protection for it. The government has made protection for innovative potential to be able to grow this thing properly, so that overseas and foreign national companies that are growing this at the same time, it's a way to protect national interests going through a patent, and that's sort of what we're going to sort of talk about here with this minimum patent market valuation. But those are some of the assumptions and presumptions, and just basically like, no, that there are laws to this that say this is what it is. They don't really outline the consequences of it, but at the end of the 20-year period, you should have like an industry that is able to stand on its own 2 feet without any government assistance whatsoever. That's perfect competition. That's when you see people on the stock market, when they do an IPO, or they're talking about, oh, Google stocks are doing this today. Google is in a perfect competition. Tesla is in a perfect competition. How the company itself has been subdivided for the public, that public portion, traded stocks, that's a perfect competition. This is not a perfect competition. This is not a competitive marketplace. This is so suppressed, only I may exist in it, basically. If you'd like to do business, that's different. I legally sign off who enters and who exits this. If you think that's unfair, it's because it is unfair. There's a lot of education behind this, and even the oncologists have to laterally transfer their current education to understand what this machine and what this device is doing. So, our minimum patent market valuation. With the issuance of the Canadian patent in August 2021 and the issuance of the US patent in December 2021, innovative potential's developments phase is considered complete. While there will always be new developments, what is considered as startup work is finished. Below is the valuation logic for the patent market, which have been valued together conservatively at approximately $1.89 billion, depending on the value of the quality-adjusted life-year variable and the value of the national currency used. A patent is a legally enforceable guarantee from the issuing federal government to exclude others from participation for a specific product, set of products, or processes for the duration of 20 years. Patents help to define and establish control a new market to better study and understand the nature of the invention. If only one person does something, it is better than 10 to avoid confusion and confounding actions like wasting resources. The content of each patent is unique, and the scope of each patent is definitively defined, thus making valuation non-conforming and uniform by definition. The nature of the variables underlying these calculations are described at length in Boudreau 2012. In order to evaluate the market created, and thus the investment need opportunity, Innovative Potential uses combined national cancer statistics of Canada and the United States. Over the life of the patents, there will be approximately 43,600,000 new cancer diagnoses in Canada and the United States. The electroactivated chemotherapy technique is designed for use in patients with poor health conditions, and for the sake of estimation, a 2022 estimate of 1,889 deaths by cancer per day in both Canada and America will be used in calculations as the most conservative estimator for EAC application. This value is combined from the data of the respective nations' 2022 Cancer Society reports. As living patients, health complications and recovery rates will change the technique's applicability to the approximate 2,180,000 people newly diagnosed with cancer per year over this patented time period. Because the chemotherapeutic potentiostat is mechanistically new and a surgical technology for intratumor injection, it is anticipated to apply to at least 1,889 cancer patients per day, regardless of specific cancer origin or stage. It is also expected that the chemotherapeutic potentiostat is able to be used on average 1.5 to 2 times per cancer patient during the course of their lifetime. Therefore, it is expected that the most conservative estimate possible is that at least 1,889 EAC procedures can be performed per day with this device, or approximately 31.6% of all new cancer cases per year. This value is actually significantly greater in reality. It is expected that at minimum, the chemotherapeutic potentiostat will be used in 689,485 procedures per year. So, if approximately 700,000 procedures are performed per year using a chemotherapeutic potentiostat for the next 15 years, then 10,300,000 procedures will have been performed over the remaining duration of the patent, circa 2023's year end. With approximately 6,900 hospitals in Canada and the United States performing 700,000 procedures using the chemotherapeutic potentiostat, approximately 100 procedures per hospital per year will be performed, or 0.27 each day, or 1 procedure every 3 days per hospital. As a planetary first, the devices belonging to Innovative Potential are unpatentable outside of the United States and Canada, as the invention has been declared through the Patent Cooperation Treaty and a set of academic publications. Other nations may construct, sell, and use their own facsimile devices, but will be excluded from the importation into the US and Canada without paying Innovative Potential until 2038 or the next 15 years. As of November 3rd, 2022, sadly, due to poor academic institutional governance, no commercial financing options, illiquid lenders, and disinterested venture capitalists, approximately 688,390 people have died since both patents were issued in December of 2021. 3,447,000 people have died due to cancer within the United States and Canada since the preliminary patents were filed in 2017. 8,949,070 people have died from cancer since the apparatus was invented in 2009. Without proper financing, 3,759,400 untreated people will die from cancer by 2038, within the patent's temporal and geographical jurisdictions. There are approximately 224,720 total operating rooms in the United States, and 1,243 operating rooms in Canada, for a total of 226,000 operating rooms. If a chemotherapeutic potentiostat is produced at cost for $60 after scalar manufacturing investments, and 1.5 units are purchased per operating suite within Innovative Potentials patents geography, then the market floor is $20 million in unit production costs. Purchasers will want approximately 1.5 units or more per operating room to keep in serviceable rotation. There are cleaning times for reusability. The $20 million estimate is for a model made from reusable plastics and ignores repurchasing of components or models made from disposable or biodegradable plastics. These costs do not include manufacturing creation costs such as real estate, tool and die manufacture, engineering, legal, regulatory, scientific, biological, or other expenses. Please see 5.2 patent references, and please see 5.3 technical references. Basically, what this last section says is that the Joey unit itself can be made for as cheaply as about $45 to $60. But in order to get 1.5 Joey units inside every single surgical suite north of Mexico, that will cost $20 million in materials. We don't have the world itself, the globe, the planet, the earth, doesn't have a factory dedicated to the manufacture of this device. That's what that last paragraph talked about. To monetarily value of the patient is to put a value on the lives of cancer patients in their time of most need. This was already done in the creation of the technology itself. However, the technology is deemed cost-effective and adoptable if the procedure is less than $50,000 with quality-adjusted life year, an industrial standard value that incorporates the cost of performing a surgical or medical procedure. So, if 1,886 procedures are performed per day at a cost of $50,000 each, then the absolute most conservative patent valuation is $94,300,000 per day for 20 years, or $1.866 billion total. This is the minimum market floor value of both patents adjusted for inflation circa 2022. To adjust this value for inflation, please use the current year's cancer deaths per day value. As of December 31st, 2023, the remaining minimum patent market valuation for these markets is 15 years, and estimated at $1.4 billion, and has an estimated depreciation of $93,300,000 per year across the full 20 years until 2038. So basically 1 year at Innovative Potential is worth $100 million. We don't have it. It's what the Canadian government and the United States government have agreed to in letting one person take action for perfecting the Joey unit. That's what that is. So if the patents were sold to Pfizer, it would still exist. It wouldn't change anything. If Pfizer owned this, it wouldn't change anything. If it was sold to China, it wouldn't change anything. That's basically, it's more of what the law is worth. And because the law only has 20 years associated with it, we take the full amount of the law, and then we have only 19 years left. And then we figured out what 1 year is going to be worth for this technology. Therefore, if Innovative Potential were to issue shares, a 1% share in Innovative Potential's market, the patented market, is worth, in 2023, will be worth $14 million. So if you want to buy into the exclusivity of this marketplace that was built, the 1% entry is $14 million. Please note, the patent market valuations are not a valuation of the company, only the monopolized markets owned by the company. It takes zero accounts of materials, supply lines, man hours, or service hours to function or operate within those monopolized markets. The minimum patent market valuation is only used to value the national laws and does not value economic output, post-treatment, company value, or direct medical services. And fun fact, this patent valuation is equivalent to the increased production of 23 million barrels of crude oil at $80 per barrel over the 20-year life of the patent. So that's just basically saying that if you take the full value of the patent and sort of turn it into how much oil you're going to need to be able to, have the factory and do all that stuff, it's about 20 million new barrels of oil would be required to service 370 million people in North America. That's economics. And yeah, so basically going back to this, I'm going to repeat this, where it's like the minimum patent market valuation is only used to value the national laws and does not value economic output, post-treatment, company value, or direct medical services, because even if you go back to the assumptions on this, nothing that I do, nothing that I do, nothing that you do, nothing that Innovative Potential does, nothing that Pfizer does actually affects any of these numbers, because the 1886 is a national number for the amount of people that died in the nations, the two nations. We don't control that. We control that through prevention and treatment, but we don't really control that one. The $50,000 is not controlled, is controlled by the nation also. And the lifetime of the patent is controlled by the nation. So the nation's actually still in control on this. We're just sort of leasing power. So onto the minimally viable product. So basically on that note, I'm going to say it's like the cost of the Joey doesn't actually factor into the minimum viable amount of the patent. So that's kind of that's what I wanted to sort of recap also on this, where it's basically the cost of the minimum patent market valuation is just when everything's said and done, the fact that you don't like the inventor doesn't matter, because the country is still responsible for this in some way, shape, or form. That's what a minimum, like, how it's a measure of how is the nation going to be responsible for this. So and that's the important part of the minimum patent market valuation metric, because some patents, when issued, actually will not have a minimum, like their number could actually be zero. So if you don't affect a national statistic for the betterment of someone in any way, so it's like this pen could have an extra little gripper on it, right? It's super cheap and easy, but it prevents, I don't know, letting go of the pen, or a writer's grip or something like that, like calluses for building up or something. That in no way affects anyone, like that invention or that device in no way, we're not discounting the fact that it is an invention. What we're saying is the minimum patent market valuation for that invention would be zero, because it's not actually doing anything. We don't need to buy into it. Because every citizen can live their life without a pencil gripper, for the most part. Except for the people who actually have one or like them, everybody else gets along fine without them. You don't actually need them. It's not a national concern. The minimum patent market valuation is a way to say, well, how much of a national concern is this? Do we have to compare, or do we have to pay attention? Or if it's 500,000, who cares? If it's $1 million, whatever. Well, we're talking about something that the health sciences is saying this is worth about $2 billion to both nations combined. So when all said and done, this is actually incredibly, extremely important. It's like national priority, like 12, along with like your defense. So there's a little bit of statesmanship and state value numbers. So minimally viable product, because all of those numbers don't actually incorporate the patent market valuation doesn't actually incorporate the cost of production of the product itself. And that goes into the perfect competition side of things, where there's the monopolized market and then there is the perfect competition. So the perfect competition depends more on the minimally viable product numbers to say, are the people going to pay this amount? Are they going to do this type of thing? Blah, blah. You know, you already kind of know the stock checkers rhetoric if you watch MSNBC or CNBC long enough, when they're doing like Mad Money and Kramer and those shows. They are not talking about this. They are not talking about, while the companies might have patents, those numbers are not associated with the patent in any way, shape, or form. They're not even associated with the minimally viable product. So there's a lot to sort of like just live on the hyperplane right now, because there's a lot that gets shaped during this industrialization process. So the minimally viable, which now we're just going to talk, so we kind of went like this. We're coming down into that funnel shape. So now we're just going to talk about the joy. Of the patent that was issued, the most analog iteration of that technology possible is the minimally viable product. It is, here's my pen, here is, I'm going to use a hair scruncher, but here's a pen, here's something we put on the pen to provide a cushioning for the wearer. It might not be astro foam, it might not be corrugated foam, it might not be an epoxy resin. It could just be a cotton ball wrapped around a pen because your finger hurts. That's the minimally viable product. It might not be the minimally viable product, the MVP, might not be the product that you're actually going to want to have to sell to people. And it might not be the one that you see at market. It's the unit that is going to perform all of the functions described in the patent. And it's probably going to be ugly. So, this project was separated financially into two parts. The minimally viable product. The first part was in partnership with the Northern Ontario Heritage Fund Corporation, and then independently. The portion of the project in partnership with the NOHFC produced a round of working prototypes. The NOHFC offered 50% rebated reimbursements for participating in their Northern Innovation Program. The prototypes developed in partnership with the NOHFC cost $1,615 Canadian in materials and $13,000 in labor in 2018. While the NOHFC was able to contribute financially, the time spent in documentation and overhead was counterproductive and business harmful, so their services were discontinued in 2019. The second portion of the project produced the minimally viable product, MVP. Actually, the first product thesis produced the first working unit. The NOHFC produced an iteration of the unit that was more complicated, but more closed, the first patent unit. So the first patent unit was done in cooperation with the NOHFC. The first apparatus unit, the first patent unit, and the minimally viable product. So there's sort of like a 3 staging points, and then you get into like the alpha, beta, commercialization, product launch, engineering stuff. So if you ever kind of like Google medical device development, this is all pre-alpha work that's being done. Your minimally viable product is pre-alpha. They build on pre-alpha. They build on that to get you your alpha and beta builds. Okay. In the second phase of the project, it costs $42,000 to produce the MVP and design files. Table 2 below shows the cost category breakdown. Work for the MVP was undertaken in 2020. Table 2 presents project cost categories like raw costs of prototype development, including overhead like the shipping costs associated with the importation of raw goods. Going forward into the future, overhead costs are able to be reduced drastically per unit because the cost associated with the development of manufacturing or production protocols is removed. Table 3. Table 3 includes the costs of labor in its presentations and shows component costs. In Table 4, below, a more detailed breakdown of labor and material costs are presented. So what happened in Table 2? So in Phase 1, it was a basic form and function exploration phase to say, here's the base unit, here's the electrochemical cell, how much more what is actually required to make the minimum viable product. So you're not putting attention to detail in, you're just getting basic, like, here's a basic skeleton, go from there. In Phase 2, you already know that information. So now you're saying, well, this didn't work. In Phase 1, this sucked, this sucked, this sucked, this sucked, that didn't work, this didn't work. We need this here, we need this there. And so you've automatically identified all of your problems in Phase 1 when you go to Phase 2. And that's where the huge jump in administration costs comes in, because you're now having to sit down and document all of those changes or additions required to provide you with the minimum viable product, in addition to labor and material costs of physically manufacturing that unit. So while labor and materials, it's one of the things where materials is fine. Materials is actually really quite cheap. They're if you save up all of your Christmas money, you can afford the materials. Labor is expensive, but you can get what you want for under $5,000 most of the time. So it's sort of like a household. You work your job. If you put a little bit of money away, you can save up that money within a month or two to be able to month or two or 6. But it's within a year you can buy the material, you can buy the skills and services to actually manufacture one. But if you have to sit down, if you have to pay somebody to sit down and write out all of the reportings and the documentation required to teach someone why this is not done, or why this is done, or why it happened during this discovery process, that's where your costs are going to balloon through. So it's like, how bad of a legal case are you going to have to fight? And that sort of fits into your administration costs, because what we're doing here now is saying this is everything, every step of the process, and all the there won't be claimances. These videos are now legal. These videos are now considered as legal evidence. So anyway, the cost per MVP component. So your patent idea, the cost to make the cheapest version of it that fits all of the criteria of the patent is the cost per MVP component in Table 3. And for the Joey, that's $370. And most of that is because we don't have injection molded polycarbonate cups. We had to have, it was the method of manufacture. You're going to really see, with Table 3, you're really going to see where the costs of manufacturing methods between manufacturing methods are going to like, you know, really, really just like stand out there. Like they're there. They're in your face. They're extremely in your face. We can do it this way. So anyway, when you break that down, when you break that $370 down into material and labor costs of the minimally viable product, circa this, and these numbers are circa 2020, you're gonna see how your labor and materials are actually split per unit. So what we do is like in order to purchase the raw materials plus taxes and all of that, we get how many units per purchase of raw material. We can get X number of refined working units from that purchase of raw material, and then per unit, that's what that cost is, sort of coming out on the other side. So that's where, so we can buy 2 feet of polycarbonate rod for $260, but one Joey unit will only consume $52 worth of that same material. Get what I'm saying? So our materials are about 1/3 of our labor. So it's a 2-to-1 ratio, basically what's happening. And we can get, with better manufacturing, so if we could injection mold polycarbonate cups, we're gonna have to do another major sort of design phase on that. But if we can design the polycarbonate, we can get injection molded polycarbonate cups, then that $50 per unit material can go down to like 10. So we instead of $80, we're gonna cut, you know, $40 out of this. And it's gonna be $40 per unit material. So that's sort of like where and how the rest of this industry kind of like really just like, there's huge headwinds here that are coming. We just need the investment dollars and time properly. So that's that, and then the same thing was done for labor. So out of the $370, 82 is done for just material purchases, and 288 is done for material services. So manufacturing, having people manufacture that, and what do I want to say? There's something in here I gotta say too. I don't know. Okay, I want to say something. I might come back to it as I read, but from table 4, $370 Canadian for the minimally viable product, so the Joey, is translated into $481 US dollars circa 2020. Oh yeah, that's what it was, COVID. We're gonna go back to COVID here. All of this is done during COVID. So this is like the worst case scenario where the cost and price of all of these items now have mask markups, now have shipping delay markups, now have this has all of that COVID markup stuff associated with it. So this is like simultaneously in the worst set of working conditions, literally when you're forced to close down. These are the prices. So this is the best worst case scenario we have. This is the model. The model is the best working case scenario. These numbers weren't pulled from pre-COVID. They're all coming from 2020, 2021, and a bit of 2019. So from table 4, 370 Canadian for the MVP and 481. So if you just move it, and that's circa 2020. Using a 3-year 3% inflation rate obtained by averaging US values from 2017 to 2021, the 2022 cost per MVP would be approximately $496 US dollars. So basically, 2.4% inflation over 5 years. Cost analysis. A majority of the cost per unit in Table 4 come from a lack of injection molding techniques, particularly the polycarbonate shell and its manufacturing process. Future improvements would be to incorporate the use of injection molding to decrease the cost of manually creating the polycarbonate shell from computer numerical control machining techniques. The membrane is a highly refined medtech material that may have its price reduced with volume of purchases. Its purchase price is considered as an uncontrollable factor. The cost of labor in both the polycarbonate shell and the pole mount both incorporate the third-party manufacturing processes in the cost of purchase. It is anticipated that injection molding units will significantly and drastically decrease the price per unit made. And this is where innovative engineering comes in. We want the engineering to get those prices lower. $370 per unit is purchasable, but when you know they can be as cheap as $40, you want the $40. You're gonna push really hard for that $40 unit. And that's sort of that's an argument for a minister of a nation. So shipping costs. The 370 Canadian manufacturing price does not include additional costs like packaging development and design, packing materials, inventory tracking, insurance, and the cost of basic ground rate shipping. And those are with I think that 370 is with taxes included. So there's a 13% markup on top of that. Table 5 presents a set of additional cost estimates to the MVP unit cost. And this is back in 2020. So back in 2020, it's basically you're paying the person, the materials used to protect the object is nothing compared to the service cost of having the person do the shipping for you. So there's a $60 shipping charge and a 40% insurance, which basically increases the price by about $100 to ship it. So it's $100 to ship a Joey. In total, the estimated cost to ship is 465 Canadian without tax. With tax, the estimated cost is $526 Canadian. Shipping estimation in US dollars is $123.98 US dollars, or $605.77 US total, and there's no taxes included in that. And all of these numbers are financial numbers at cost. There's no markup, there's no incorporated, we're going to get into that later. In 2022 dollars, it would cost $539 Canadian and 600 with tax. So taxes are included in the Canadian values, and there's no tax included in the US dollars. In 2022, it would cost it would cost 539 Canadian and 623 US dollars to produce and ship a Joey unit, adjusting for inflation using a 5-year average. So in Canada, inflation has risen 2.4% over the last 5 years, and in the USA, that's about 3% from 2017 to 2022. This is a difference of $12 Canadian and 18 US dollars respectively. The minimum retail, so at cost values. The minimum retail price for a minimally viable product. Parts and components are listed below in Table 6. Values are derived in part from Tables 3 and 5. So basically what's going on here is we're showing in 2020 dollars, even though it's $465 to buy, make, and ship a Joey unit, which the Joey unit has the core, the outer shell, and the shell holder combined. Like all three of those combined to make a Joey unit. So all of the units combined will cost $465, but we have to put an $1,800 markup on it for the rest of the overhead, and that's sort of what we're saying here. Well, how much is the actual cost going to be? So the markup is not a profit margin. It is how the price of the minimally viable product is established to account for non-minimally minimally viable product dependent variables such as standard of living costs over time categorically associated with housing, transportation, lifestyle, equipment, storage, energy, inflation, food, fuel, labor taxes, human error, and acts of God. Most of the aforementioned variables are independent of each other, but still factor into the cost of a unit being produced. While these values are calculatable, they are best derived by just understanding how much it will cost to produce a unit in real time based on the unique combination of equipment and services available. So what does that all mean? It's like, you might be able, I might be able to get you a Joey for $465.98 living in my parents' basement, but if I have to drive anywhere, if I need a car to drive it to you, I got to put another $1,800 on that because it's going to pay for the car insurance, it's going to pay for the fuel for the car, it's going to pay for the down payment on the car itself, it's going to pay for the electricity required to pick up the phone, it's going to pay for the phone for you to, it's going to pay for the internet bills. That's sort of what the markup is. It's like, here's the one thing you want, but here is the rest of the world in which that one thing that you want exists. So the at cost price of a Joey system in 2022 is $540 and 623 US Canadian and 624 US dollars. No taxes. This does not include the price of a power supply, vial adapters, tubing, drugs, lure lock connectors, needle syringes, or labor. And that takes us to the end of health value economics. So basically, all of that is basically the story of what innovative potential went through to get something a little bit better than batteries and pencil lead to be able to help you enhance your drug efficiency. It's still not the robot unit. It's still not the robot unit. It's still not the handheld unit. It's still not the surgical unit. It's still not the pipette unit. It's still not the gauntlet. It's still not these other units. It's just, how do I want to say that? It's not the sheer desperation. It is the one thing that's going to work, but we still have to add on a whole bunch of engineering to make it reach the safety standards of the hospital surgical suite. So unless we're going to have your hospital staff listen to every single one of these lectures on how and why this thing works and how to guarantee that it's going to work for you in the surgical suite, because currently this use still almost requires an HPLC to verify that it is on and that the drugs are being activated. There's a way to do it chemically to show to add a color reagent to it so that when the drugs get activated it changes color, but that's a development and engineering cost. We know what that is. It's because it's acid base dependent. We can just have just to show that the cell is on, we can add phenolphthalein as a color indicator, or we can add a color change chromophore to show that the molecules are reacting, or have a little blotter paper worked out. So it's not incredibly difficult, but it is, again, you need that. It's an 80-20 split between cost of labor and documentation and materials, and basically until we get it, you're all screwed. Because not even the science is getting done to perfect it. So there's no science, there's no engineering, there's no medicine. It just stops because we need money. So the estimated patent market valuation of innovative potentials patents. We kind of went over that, but we're going to recap it here. The minimum patent market valuation for innovative potentials Canadian patent 3035406 and American patent 111,989,43 is $1.86 billion for their full 20-year lifespans, adjusted circa 2022. This valuation is dependent on the following variables, but both nations' death by cancer per day, which is 1886 using 2022 numbers, a $50,000 quality adjusted life year, and the duration of the life of the patent. for 20 years. For detailed, so we just talked about that for last hour in health value economics. Rewatch this video rewatch this video if you need a better description of what a patent valuation actually is. It's sort of saying to the entire country, you guys are going to need this. It's not an invention for a pen holder. That's sort of what we're saying here. It's a way of saying a country's laws have to adjust by this much in law, because that's how important it is. Currently, the remaining minimum patent market valuation for these markets is 15 years and estimated at $1.4 billion, and has an estimated depreciation of $93 million per year across the full 20 years until 2038. Basically, every year that the patents are in effect, they lose, or rather, they lose about $100 million every year. Please note, the patent market valuations are not a valuation of the company. Only the monopolized markets created by the nations and put in name of the company. So it's sort of like this idea was entrusted to you because you came up with it. Let's see how far we can go. You will need this, take this cat, it will protect you. So a 1% share in the patent markets is worth $14 million at the end of 2023. And that's basically it. That's it for today. It's a lot, and there are other things that can be done. I'd like to thank you for listening. Hopefully the music wasn't too loud. The previous time I read this the music was too loud, but this seems to be okay. So if you have any questions about a non-financial context, check out the YouTube page, subscribe and like, and there is there's a cancer biology talk like this. It's only an hour. There's a cancer biology talk, there is a health literacy talk, there is an asset creation talk, there is an electroactivated chemotherapy talk, and then there's a corporate talk, just sort of saying like, okay, well, make this make sense in terms of like what type of information, what type of job, like what type of schooling do I need to get a job with innovative potential, and we talk about that in the 2022 update. So the first half is sort of saying this is how the social section is structured, but then here's all the other little subdivisions and subsidiaries that are actually required to get to this conversation right now. So I'd like to thank you for your time, and I'm going to play the innovative financial song. So sponsorship was brought to you by Innovative Financial. And this is our theme song.
La 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 la. Innovative Financial. La.
So we're working with that. If you don't know what we're talking about, pay us and we'll tell you. All right.